trends and cost containment related to healthcare systems. One of the trends that has been going on for quite a while is cost containment. With cost containment, what happens is there is this effort to try to control the rising cost of healthcare, where you achieve the maximum benefit for every dollar that you spend. And this transcends through all of healthcare industries and healthcare systems. Some of the reasons why healthcare costs have gotten so high are things like technological advances. If you look back to history of medicine and you discovered some of the things like the development of the kidney dialysis machine, artificial hearts, development of typing and cross-matching, discovering the human genome and opening up other kinds of various treatments. These things like transplants and special devices and special machines have drastically contributed to the high cost. These are great advances, however, they are not free, and it requires a certain amount of money. Other things that have happened is the population has aged. So along with all the technological advances and development of pharmaceuticals, people live longer. When I was young, probably the life expectancy of a person was 72. Now, the life expectancy of a person is well into the 80s. So as the population ages, we see health problems that never were treated before because people didn't live that long. So you see more people having chronic diseases, needing healthcare services. However, they live for quite a long time with those issues. Another reason is increase in health-related lawsuits. Because we do live in a very litigious society, there are issues where people sue, justified or not. Some are justified, some aren't. So whether they're justified or not, healthcare providers have to obtain malpractice insurance, and malpractice insurance is pretty expensive. Also depends upon the type of situation. In other words, one area where there is a lot of lawsuit potential is in maternity and delivering babies. That tends to be an area where the malpractice insurance can be very high, just as an example. Also, with so many advances, more healthcare providers, in order to prevent a lawsuit, they are sometimes forced to order diagnostic tests, even though they may not need to order them, because there may be a fear of a possible lawsuit if they don't use a test, even though it's not necessary. Also, healthcare providers have to practice defensive healthcare to avoid a lawsuit. That means that you may be encouraged to do some things that may be expensive, but may not be necessary. However, that drives the cost up. Ways to control costs or cost containment. Some examples we're going to talk about. One is diagnostic related groups. It's one way that Congress has been trying to control costs of Medicare and Medicaid for many years. The way it works is that patients with a certain diagnosis who are admitted to a hospital are classified in a payment group because they tend to have the same kind of tests and the same kind of procedures. There's a limit placed on the cost of the care, and the agency is then paid at a set amount. This encourages the agency to provide care within an expense limit. So the way it works, if the cost of care is more than the amount paid, the agency must accept the loss. If the cost of the care is less than the amount paid, the agency gets to keep the extra money. So that's kind of how that works. Other methods of cost containment are a combination of services. Okay, this is done to eliminate duplication of services. So healthcare agencies join together or share specific services so as to provide care to a larger number of people at a decreased cost per person. An example. Large medical laboratory may have expensive computerized equipment capable of performing thousands of tests per day at a cost substantially cheaper than a small laboratory with less expensive equipment capable of performing a limited number of tests in one day. So if, let's say, you have a health issue and you need to see a specialist, well, your specialist may order some tests to kind of see how you are. Those tests would then also be shared with your general care physician or another physician that you may have to see, so those tests don't have to be repeated. So it's one way to save money. Another is outpatient services. So you'll see more and more, there's been a big trend where more surgeries are done in outpatient clinics as opposed to inpatient because the cost is cheaper. And remember, I think I had talked to the class about how patients tend to do better at home. So there's a big, so it's kind of a good thing. It saves money and people do better. So more things are done on an outpatient basis. Okay, another cost is mass or bulk purchasing. Things like that would be like an example in our school district when teachers want to order some supplies. We have a distribution center that we can order things from, like pencils and paper and glue, gloves, a whole bunch of things. And so the school district buys these things in mass quantity, so the price is cheaper. And so in a healthcare facility, this is the same way. Hospitals and will buy quantities of things that they know they use a lot, and they have a sophisticated way of tracking it so they can cut the cost down. Also, early intervention and preventative services as far as healthcare can drastically cut the cost. Examples are like immunizations, regular physical exams, easy access for individuals, preventative care. So one of the things that immunizations, for example, does is if you were immunized against a disease, then you never get the disease, hence you never have to suffer any of the consequences, be admitted to the hospital and receive a long, lengthy, expensive treatment. And then you're healthy. So it's kind of intervening in there. Okay, other costs are energy conservation. Energy conservation, they monitor the use of energy to control costs and conserve resources. If you look at the size of a healthcare facility or a major hospital, they use a lot of electricity, a lot of water, and a lot of natural gas. So if they can develop a way to maybe dim the lights when people aren't in the room, changing light bulbs from incandescent bulbs to either fluorescent or maybe now LED bulbs, tend to use less energy. So one of the agencies that researches and identifies standards of treatment to follow as far as patient care is called the Agency for Healthcare Policy and Research. What they do is enforce the fact that healthcare should never be compromised to save money. So when you talk about cost containment, it's usually things that are outside of providing health care to people because you don't cut cost for that. Some of the trends you see in healthcare are as home healthcare. If a person has a shorter hospital stay, then and they go home, they may still need some services, but they don't necessarily have to have full-time service in the hospital. So let's say a patient, a long time ago, would have bypass surgery. Patient would maybe be in the hospital for 2 or 3 weeks. Okay, now it's pretty much 5 to 7 days if a person has cardiac bypass surgery, and they're walking the next day. They get them up out of the bed and make them walk around because it gets them moving faster, and then they send them home. Because remember, it's that whole thing, people tend to do better at home than they do in a hospital. So you want to try to get them home as quick as possible. Also, they can develop infections in a hospital. So yeah, home's a good place to be. Home health care also can provide things like nursing care, physical therapy, occupational therapy, and so on and so forth to be that connection back to the hospital, however the person's at home. Okay, we also see with our rapidly growing population that there's geriatric care has become a big area of medicine, and it can be very expensive. Geriatric care refers to care for elderly people. We have a large number of people that are living longer than they used to be. So you see things like adult daycare centers, retirement communities, long-term care facilities, and so on and so forth. And these also, raise the cost. Another trend that developed is regulation regarding long-term care. Because now we have all these people that have aged, and so now we have more facilities and services that we provide for them. So that leads to now you have to have regulations so abuse and neglect do not happen to people. So back in 1987 was the Omnibus Budget Reconciliation Act, referred to as OBRA. There's some things that were laid out in here as far as regulations. A few of these are training and competency evaluation programs for nursing and geriatric assistants. Basically, if you work in a long-term care facility in a nursing assistant, you every year have to go through a retraining, or recertification. Also, continuing education was mandated, providing evaluation of performance and retesting, which is what I was talking about, if a person's been out of it for more than 2 years. Also, in this act, it addressed compliance with patients' rights guidelines to ensure rights are observed and enforced. And we will talk about that as we move into other areas of in the Principles of Health Science course. Okay, other trends we're seeing in healthcare are things like telemedicine, where you can use video, audio, and computer systems to provide medical and or healthcare services. A simple example would be EMTs use technology, it's a tablet or a computer and a tablet, to transmit medical data in transit to the emergency room physician at the scene of an accident. So basically, they're at the scene of the accident. They get on their system. They can send information to the physician at the emergency room they're going to. So they are prepared for who's coming and kind of an idea what's going on. Surgeons also can use a computer to guide a remote-controlled robotic arm to perform surgery on a patient many miles away. This is one of those cool things that's been happening. Also, video via satellite. A surgeon can direct another surgeon through a detailed surgery, and they're not there. They're just there by video. There's tons of things developing in this area. Okay, other things are wellness. We are much more aware, I think I've mentioned this in class, that our knowledge base as far as disease and what causes it is much better. It kind of goes back to that history of medicine thing. With that, we are much more aware. So we focus on wellness, state of being in optimal health. We have come to recognize the importance of exercise, good nutrition, weight control, and healthy living habits. Monitoring your blood pressure, watching what you eat, keeping a healthy weight. These are all things that we've recognized that help maintain you. Other things, 3 factors and ways to promote wellness are things like physical wellness, emotional, social, mental, and intellectual, and spiritual. These all lead into the whole wellness approach. Holistic care promotes physical, emotional, social, intellectual, and spiritual well-being by treating the whole body, mind, and spirit. So if you look back to the stuff we did in History of Medicine, there's many things that we've picked up from different centuries. Many ancient people believed in treating the whole body, not just a part of it. So all these things have built on to be where we are today, and holistic healthcare is one of those. We also have in healthcare alternative and complementary methods of care. Alternative therapies are those treatments that are used in place of traditional biomedical therapies. Complementary are those that are used in conjunction with conventional medical therapies. Examples are things like acupuncture, homeopathy, massage, and so on and so forth. Skip the slide. Sorry about that. Alternative is used whether or not the therapy is used in place or in conjunction with conventional medical therapies. So what we're seeing is a lot of this combination. People are going to some alternative therapies in combination of the traditional medical treatments. Okay, National Healthcare Plan. We actually did this today in class, or earlier in the week. We did an exercise on the Affordable Health Care Plan. And this whole National Health Care Plan has been going on for many, many years, or trying to develop one. And it was due to this high cost of health care and the large number of uninsured individuals. Okay, today, the current plan, which you guys did an exercise on, is the Affordable Health Care Plan, commonly referred to as Obamacare, because remember, those two things are the same thing. And the goal is to ensure that all Americans can actually get health care coverage. Health care coverage can be quite expensive, so hence it's called the Affordable Health Care Act and Plan now. So that's how that developed. And that concludes the presentation for today.